Welcome to DDCP interview session with Dr. Rahman. So today I would like to talk about courage during the work in pharma industry. So Dr. Rahman, how can someone develop a mindset of having the courage to take this different path of working as a physician in pharmaceutical industry? People need courage when they make a decision to join pharmaceutical industry, and also when they find the new opportunity of career after joining pharmaceutical industry. So what is your advice to develop a mindset having the courage during the career?
Thank you for the question, Dr. Saria. So as I talked about in one of the earlier chapters, the great Nobel Prize winning writer Hemingway defined courage as grace under pressure. It has been called the first of all virtues by the ancient Greeks, and everything else flows from that. For you, courage will be required in two ways. Number one, what it is that you want to do with your life, your career. And number two is courage on the job to make sometimes difficult and unpopular decisions. Let's start with the first. You're working as a practicing physician. You may be very happy, but you may want to explore something else. How do you go about doing that? The first thing is to think of what it is that you're looking to do. It may not necessarily be in the pharmaceutical industry. Maybe you want to go work at the PMDA. You're interested in working with the government. So 3 questions. What do you want to do? Where do you want to do it? How much do you want to get paid? That then sets up your decision points as to what you want to do. And once you have decided, once you have that grace under pressure, you then move forward and work through the decision that you've taken. And when you get to work, sometimes in the pharmaceutical industry, you have to say things that are not very popular with your bosses. Say, for example, you're working in pharmacovigilance, and there is a new product that is on the market that is in clinical trials, and you're seeing a lot of liver dysfunction. You're worried about elevated bilirubins and liver failure and Hy's Law cases. You need to say that this product should not be developed. Now, the company has spent hundreds of millions of dollars. Saryu-san may not be very happy with you, but an enlightened leader will recognize your courage and your ability to ask the company to do the right thing. And I think that's what comes down into the workplace of courage, which is to do the right thing. You do the right thing for patients, for the company, and for the larger community. Sometimes when you speak up, you may get into trouble because there are companies that may not be interested in hearing what you have to say, but you still have an obligation to give the company your best advice. As an example, I was working at a company and they were looking to do a recall of a product. And I said, there are 3 classes of recalls. I said, you need to have this be a class 2 recall. And they said, no, it needs to be a class 3. I said, again, this is my best advice to you that you should do a class 2 recall. And I was overruled, and they went to the Belgian regulatory agency. And the regulatory agency said, thank you for your recommendation, but it's not a class 3 recall, it'd be a class 2 recall. Was I vindicated? Yes. Did I gloat? No. I was interested in patient safety, and that's why I made the recommendation. So you all as physicians have an obligation, a duty to do the right thing and make those choices. And it may mean moving from one company to another. I know that's not the culture in Japan, but it may mean moving from one company to another to take on new and different opportunities and to not be limited by the current company where you work.
Thank you very much. If you are alone, it's not easy to speak up. Could you give some advice to the person?
So the first thing is to make sure that you're right. If everybody else is not seeing it your way, you have to have the intellectual curiosity, I go back to that, to say, well, hey, maybe I'm wrong. If, however, you are right, the data shows you that you are correct, the next thing I would suggest is to build a coalition. There's a Japanese term for that. Walk it around and make sure that you can get 1 or 2 or 3 people to join you to make this case. And then recognize that you have a duty to do the right thing, as we talked about. So you have a duty to do the right thing. And Mahatma Gandhi said that even if you're a minority of one, the truth is still the truth. And so that will then require you to display courage and go it alone. And yes, you may get into a bit of trouble, hopefully not too much. But Congressman John Lewis, who led some of the civil rights marches in America in the 1960s, talked about something called good trouble. Seems contradictory, but good trouble is doing things that may get you into trouble that are good for the greater number of people. Fighting for the safety of patients is good trouble, even if you have to go it alone.
Thank you very much. I think it is very important before starting take the action, you ask yourself whether you are right or not, based on the data or based on the scientific knowledge you have. So this is the starting point. And then have colleagues who have the same ideas. So these are the small steps to do the big things. Thank you. I will close the chapter 5. Thank you very much.
Thank you, Thakur.